Hello, colleagues. I'm Alicia Bertone from Ohio State University, and I look forward to hopefully meeting some of my colleagues at the panel. Today, I'm focused on PulpCyte, a product from VetGraft that is a dental pulp tissue particle. Dental pulp, as you know, is being studied heavily as a rich source of stem cells. As you can see in a PubMed search, over 2,863 articles came up just a few days ago with the keywords of dental pulp stem cell. Most notably, people are investigating the unerupted teeth, both those that would follow up underneath a deciduous tooth, but more importantly, the primordial molars that are called dental follicle precursors and contain the most robust number and undifferentiated cells, particularly at birth. As we know, both these coming from neonatal foals and coming from this precursor would be the most robust in number as well as ability to differentiate. Donor does count, and as we know from human mesenchymal stem cells, that neonates contain an increase in number as well as greater undifferentiated characterizations as compared to adults. So in this particular case of a dental pulp follicle obtained from a neonate, that we have some of the greatest potential for stemness in those cells. The product is called VetGraft PulpCyte for animals and is a minimally manipulated connective tissue for homologous use. The product I'm going to describe here right up front, and you will know that this is the product that was used for all of the subsequent studies and would be available to you as a veterinary clinician. The standard dose is a 10 million count of particles that would contain both stem cells and extracellular matrix that is suspended in 2 cc's of a sterile isotonic transport solution. The viability of this has been measured at about 90%, and these cells are positive for mesenchymal and hematopoietic stem cell phenotypes. There are growth factors and proteins within the extracellular matrix. You can order this online and potentially have the product within next day delivery. Upon distribution, both the sterility, the counts, and the viability are rechecked, and once it has arrived, you have a 10-day chilled shelf life. The procurement of these cells is derived from newborn foals that pass during a dystocia. These large farms have agreed to an emergency call to a harvesting team that then arrives in, similar to harvesting organs for donation, these unerupted follicles to become mature, ultimately erupted teeth are harvested sterilely from these foals. The tissue that is recovered is handled subsequently according to Human American Association of Tissue Bank standards, including good tissue practices, good manufacturing practices, and there is a tissue tracking form for that lot that subsequently goes out with every dose that is sent off to clinicians. That form is then returned to VetGraft for maintaining on file. The viability of the cells is assessed by histology and microscopy during a calcium green stain. Calcium green is a live stain that can only be taken up into the cytoplasm in living cells that have an intact plasma membrane. As you can see in the arrows representing cells, those are nuclei, and you can imagine then the calcium is in the cytoplasm, and you can see round cells there where the dye is accumulating under the plasma membrane. In addition, there's tissue between these cells, and this is the extracellular matrix. The mesenchymal stem cells that are present in these pulp particles have also been shown to have stem characteristics by flow cytometry. Specifically on the left, you can see that about 82% of PulpCyte cells seen in the red cluster are positive for CD44. CD44 is a notable marker of adhesion and migration in mesenchymal stem cells. Additionally, about a 76% positive rate for CD90 that you can see on the right. CD90 is often called thymocyte 1 antigen and is a well-known marker for mesenchymal stem cells. In addition, there is a significant expression of CD105, as seen here at 82%, and CD105 is an accessory receptor for TGF beta growth factor that is seen on undifferentiated stem cells. This receptor allows TGF beta to have a profound effect on these cells, both to multiply and grow, as well as to differentiate. Interestingly, these follicles, these dental pulp follicles, also contain hematopoietic stem cells that are present in PulpCyte. And you can see on the left that about a 60% positivity rate for CD34 exists. And CD34 is a key marker for hematopoietic stemness that has been well identified and now has also been recognized as a precursor marker specifically for endothelial cells, even though those might be mesenchymal in origin, and embryonic fibroblasts, even though they may be mesenchymal in origin. And so this positive rate here is, again, another marker of stemness. You can also see about a 31% positive for CD45, which does represent a more differentiated form of mesenchymal stem cells. So in summary, I want to say that PulpCyte has proven equine safety and efficacy right off the bat, and we will go into that prospective blinded controlled randomized study in a minute, but also has been injected in over 4,000 cases, both those that were used for safety studies in terminal cases or in severe cases for humane use, but also for gathering a large field study information in veterinarians' hands. As well, Dr. Ron Genovese here soon will also be presenting on some soft tissue injuries with follow-up that he has used the product on. The company has also completed injection toxicity studies, tumor genicity studies in mice, and a few co-culture studies, some that I'll report here today. In our studies at Ohio State, we also evaluated the extracellular matrix composition in PulpCyte, specifically via mass spectroscopy. We identified many proteins, as you can imagine, but 253 that we identified in a table there, and if you want to see all of them in table 2 of that publication listed on the slide, you will see that in those cases, all the samples that were submitted had those proteins. And when we classified them and annotated them by the NCBI database, we could see that they fell into categories of anti-inflammation, but also elastic and adhesion activities known for mesenchymal stem cells, such as vimentin, versican, tubulin, myosin, fibronectin, and precursors of collagen 3. Also are better known maybe proteins of fiber assembly and compressibility that are known to recruit and store growth factors in extracellular matrix, such as the smaller biglycan, heat shock proteins, hyaluronan, proteoglycan-linked proteins, etc. There's also growth factors in the extracellular matrix, specifically transforming growth factor beta-induced protein, fibroblast growth factor, and vascular endothelial growth factor, as well as precursors for many of our fibers, collagen fibers, such as precursors for type 1, 3, and 9, and a precursor for type 2 collagen, which, as you know, is specific for articular cartilage. We also performed pilot preclinical safety studies at Ohio State University, and specifically to look at both potentially a dose response as well as to look at inflammation that may be associated with injection. So we hypothesize that there may be a transient inflammatory response to PulpCyte that may be different in osteoarthritic joints than sound joints. And so we had 6 subjects that received a range of doses of 1, 5, or 10 million particle counts per mil. And we also had OA joints that received doses. And as you can see in the slide on the right, in the red and the blue, which were sound joints injected with either PulpCyte or control vehicle, that there was a mild inflammatory response at day 1 that subsequently turned to baseline by day 7 and 14. And the arthritic joints, the osteoarthritic joints, did indeed show on day 1 a transient inflammatory response that returned to baseline by day 7 and 14. So we concluded that this was clinically acceptable, but that yes, osteoarthritic joints exhibited greater inflammation initially than did sound joints, but all subjects returned to within normal references by day 7. We also injected the 5 million particle per mil dose to the osteoarthritic horses and demonstrated a significant improvement in their lameness over a 2-week time period. At the same time, we assessed the sound joints and the sound joints that were injected by both PulpCyte and vehicle, and showed that none of those animals became lame. So potentially, a proof of principle was that we detected a reduction in lameness in the osteoarthritic horses, and we showed no adverse reactions. However, we understand that these are low numbers of horses that were enrolled, blinding was not possible, and there was no specific control group for osteoarthritis. We also performed some pilot allogeneic tolerance co-culture studies in which the mononuclear cells from 2 horses were co-cultured with 2 different batches of PulpCyte. And as you can see by these clusters of differentiation noted on the right there, that represent activation of lymphocytes, that in no case was their activation over a 6% level. And the classical CD4 and 8 that represent an activation of lymphocytes, the CD25 and 69 represent an increase in IL-2RA, receptor antagonist antigen on the surface of lymphocytes, and it currently remains unknown if these can be beneficial and represent a part of immunotolerance, and this is being further studied. So in summary on the pilot studies, we could say that equine dental pulp particles showed no adverse reactions after multiple injections, had some improvement in all of the horses that was injected that had OA, some early results on suspensory injuries showing positive results, and helped us design the future clinical trial that would be larger. No clinical presentation or systemic effects that could be attributed to an allogeneic reaction was identified, including in co-culture, and some horses had greater than 5 injections. And with this, we move forward into a prospective, blinded, controlled clinical trial for the injection of living dental pulp particles for the treatment of equine lameness. And at this point, I want to recognize the many authors on this paper because it really requires a very concerted effort and a lot of assistance to get these large studies done, considering the logistics and timing. Our study design was to assess if injection of an allogeneic dental pulp particle would improve pain and lameness in horses with natural occurring osteoarthritis, desmitis, or tendonitis. The design was prospective, randomized, blinded, and controlled. 40 lame horses ranging between grade 2 and 5, and actually only 2 and 4 were enrolled, ranged between 2 and 18 years, 20 of which had osteoarthritis, and 20 with soft tissue injuries that were either desmitis or tendonitis. And then within these blocks, they were randomly assigned to receive either an intra-articular or intralesional injection of control vehicle or dental pulp particles. These horses were followed during the duration of the study by many parameters that could assess inflammation and lameness. Physical examinations, seen here, being performed by Dr. Naveed Salmanzadeh, who was a visiting scholar at the time. Blood analysis of CBC and serum profiles, joint fluid analysis from the osteoarthritic horses both before and at the end of the study, and then serial lameness scores and kinetic gait analysis, and serial inflammation parameters including limb circumference, goniometric measurement of pain-free range of motion, edema scores, lameness pain on pressure, lameness pain on flexion for OA horses, ultrasound that was performed at baseline day 7 and 14, and radiography at baseline and day 14. As you can see on the ultrasound over a joint, we could actually assess the amount of fluid, the amount of synovial thickness, as well as edema that occurred in these tissues in the OA horses. All horses were followed for 2 weeks within the enrollment period of the study, and then those that had received the control treatment were offered the injection of the PulpCyte, and all owners elected for that. And so that was performed prior to release of the study. All horses that received the force plate, and for this, the horses were jogged across a force plate at 3 meters per second, and the vertical peak force was calculated in both the sound limb and the lame limb, and then subtracted and expressed as a ratio in percent, such that those approaching 0 were becoming more comfortable or even sound. As you know, exercise is critical to the demonstration of lameness and pain, so all horses were maintained in a 3x3 meter box stall and exercised every 3 days on a treadmill. The results of our primary outcome, which was lameness score, showed that lameness scores significantly improved in the PulpCyte treated horses compared to the control horses, with a p-value of less than 0.01. In addition, the treated group had a greater frequency or number of animals that became sound at day 14. When we looked specifically at the desmitis tendonitis horses as seen in the graph on the right, the blue, which represents the treated horses, had a significant reduction in lameness score at day 7 and 14 compared to baseline and compared to the control horses. When these desmitis tendonitis horses were compared to the OA horses, they had a significantly greater improvement in lameness with a p-value of less than 0.001. The synovial fluid analysis essentially showed that both before treatment and after treatment, whether by vehicle or PulpCyte, that all white blood cell counts were within normal range for the reference clinical laboratory, as was the differential, and that was less than 1,000 cells per microliter. We also specifically looked at the inflammatory mediators of IL-10 and IL-6 in synovial fluid and expressed this as a ratio of the values at baseline prior to injection and at day 14 after injection. And you can see that the treated horses that received PulpCyte had a significantly decrease in the concentration of IL-10 and IL-6 as seen on the right, whereas the control horses had a significant increase in IL-10 and IL-6 between day 0 and 14. Therefore, it can be said and concluded that the injection of the PulpCyte reduced the inflammatory mediator content of the synovial fluid as evidenced by IL-10 and IL-6. In addition to the clinical trial in horses, we also had ongoing a clinical trial of clients. And these clients all agreed to enroll and sign a consent form in which they would evaluate their horses for 30 minutes under certain conditions prior to coming to the study and at day 21 and 45 after injection. And the clients agreed to evaluate the degree of lameness, comfort at rest in the stall, comfort at turnout, as well as their attitude, appetite, and body condition. Admittedly, these client assessments were only blinded at day 0 and not at day 21 and 45 because the clients knew what their horses had received. We received results from all 40 clients because all clients ultimately opted for the treatment of PulpCyte. And as we can see in these results indicated by the stars, that the client, there was a significant decrease in scores for lameness based on the client reports. And this was degree of lameness, comfort at rest in the stall, and comfort at turnout, in which there was significant improvement with no improvement in the other parameters. We also performed a 2.5-year follow-up on horses that were in the clinical trial. And of the 16 responding clients with live horses, 12 commented on the use of the horse. And of the 12, 10 horses, or 83%, were being ridden, 2 at a national level. The 2 horses that were not being ridden still were sound at pasture. 1 is a broodmare and 1 retired. 7 of the 10 horses that were in work were sound and had scores of 0, and they were in both categories of osteoarthritis or desmitis and tendonitis. So our summary and conclusion, as approved here by a FDA specialist, is this controlled double-blinded investigation was conducted at Ohio State to assess the efficacy of PulpCyte in reducing inflammation and pain in horses with tendonitis, desmitis, or osteoarthritis. Subsequent to the completion of this exploratory study, the data was subjected to a quality review, following which key findings were addressed by the investigator and staff. Most importantly, in yellow here, the conclusions drawn from the data provide verifiable evidence of the effectiveness of the PulpCyte product. These results provide a benchmark for future investigations to evaluate the product for specific target indications associated with musculoskeletal conditions of the lower limb in horses. And this leads to the segue of Dr. Geneviese's follow-up presentations. I want to also thank everyone, including my family, because we are major horse enthusiasts. Bill Muir, of course, wrote the equine anesthesia textbook, and our son rides and has ridden to national level in hunter, jumper, equitation. And here he is performing in a polo match, the Charles Hart Club, in which they won last year. So thank you very much.